So here we go. Hello, this is Christy Carter of Global Positive News Network, and I have the privilege of introducing to you the Executive Director of the Broach Foundation for Brain Cancer Research. Her name is Deanna Kotrola. So let me give you a little background about the Broach Foundation for Brain Cancer Research. It is a 501 nonprofit charitable organization. Their mission is to promote funding for brain cancer research and education so that effective treatments and ultimately a cure can be found. So Deanna, let me ask you, why was this foundation started?
Yeah, the foundation was started by Jamie and James Broach back in 2011. And James Broach was actually diagnosed with brain cancer and just found that there were basically only 4 FDA-approved treatments in the last 30 years that had been approved for brain cancer. And so he just was not satisfied with that. And so he knew that probably the research that he wanted to fund would probably not come in time for him, but he wanted to do something and leave a legacy to help others.
Wow, that's fantastic. Wow. Very motivated to get this going. Good for him.
Absolutely.
Wow. And how's he doing now?
James actually passed away in 2013.
Okay.
So glioblastoma, which you may have heard of, is a very aggressive form of brain cancer. Senator John McCain is probably the most prominent person you might have heard of that has been diagnosed with that.
Yes.
So it is a very aggressive form of brain cancer. And so we've actually been very privileged to be able to support some very innovative and exciting research that was started through the Broach Foundation support at MD Anderson Cancer Center right here in Houston that James knew of and was a part of funding.
That is fantastic. Wow. So what do you wish to accomplish? What's kind of like the big vision here for your foundation?
Well, the big vision has always been a cure. And so James and Jamie knew that research requires resources. And they were well connected, and they really felt that that should be the goal of the Broach Foundation. And so that was really where and the reason they decided to start the foundation. And there are lots of other organizations that do a great job in the cancer community and in the brain cancer community of educating and as far as patient resources go. And so we're connected with many of those organizations as well. But our real main focus is providing resources for brain cancer research.
That is awesome. Wow. Just out of curiosity, how many people are on your team?
Well, we have a board of 11. It's a volunteer board. And then I'm the only staff member per se to run. We try to be very lean so that all the money that comes in goes directly to the research that we want to fund.
That's fantastic. So have you seen are you starting to find some possible cures, or is there some hopeful evidence for that?
Absolutely. Way back in 2011, 2012, the research that we were starting to support was practically in a petri dish.
Wow.
So it's been very exciting to see that even this year, we're now in clinical trials with some of this research. So, in 7 or 8 years, we've gone through innovation after innovation and trial after trial and iteration after iteration, basically, that now we're able to see that things are working and we're able to bring that into patients.
Wow, that's fantastic. Good for you. What an exciting venture to take on and to do. And it's just so hopeful for so many people who have this.
It really is.
Yeah, that's fantastic. So what have you done in the last 6 months that's made an impact on your community?
Well, generally, annually, we do our annual Stand Up for Brain Cancer Gala, and that's where we have a stand-up comedian come, and it's just a very fun-filled, laugh-filled, hope-filled evening where we raise our funds. And so we do that every spring, and that's something that's kind of a hallmark of what we're known for. But I would say in the last 6 months specifically, something we're very proud of is that we recently fulfilled a $5 million commitment with the MD Anderson Brain Center and the research lab that we've been supporting. And that commitment was made early on when the foundation started. And so we've been working hard to fulfill that commitment. So
Oh, wow.
$5 million has been out there, and we've been
Awesome.
working hard, and we finally reached that goal.
Congratulations. That is quite a goal. That's fantastic. Wow.
Thank
Very
you.
hopeful. I love it. That's so
Thank
great.
you. Yeah.
So I know you just mentioned the spring gala that you have, and I think that's such a refreshing take, to have a comedian come in, because, the whole topic of cancer, people don't like to talk about it. It's kind of like a taboo thing, and
Right.
it's just good to get a little bit of comedy in here and lighten up. I mean,
Absolutely.
studies have showed that people who are happy and laugh and joke around, have less stress and have less disease.
Right.
So,
And that all came from James and Jamie from the very beginning. And that was, I
wow.
think, his heart and his intention is that this is a serious topic,
Yeah.
but we're
Yeah.
gonna have a good time supporting it and talking about it and raising money for it. So
That's fantastic. Oh, I love that. That's so great. Wow. So, Deanna, what positive news do you have for our viewers today?
well, I would say I'm so glad that we get to talk about this because I was recently at a brain cancer conference and just came away with some positive news that I was excited to be able to share with you because these are leading innovators in brain cancer and research and are leaders in their industry. And something that stuck with me that I walked away with was one of the people on the stage that was talking in the panel said, we're really in the golden age
Oh,
of
yeah.
brain cancer and of research right
Right
now.
on. Mm-hmm.
And that really stood out to me because, we do hear that survival rates are, what they are. We do hear that, hey, there, in 30 years, there have only been 4 FDA approved drugs. And now there has been one device approved, a special cap that's been approved, but that's just not enough to give us the survival rates that we're looking for. So we still have a long way to go.
Yeah.
But to hear these people say that we're in the golden age now
That's neat.
of research, I think a lot of that really has to go to the fact that immune therapy is really the next frontier of cancer treatment and cancer cures. And I think we're seeing that in other cancers. We're seeing cures happen in other cancers like melanoma, and we're seeing cure rates in percentages of populations that are very significant.
Wow.
And so as we're seeing that with immune therapy, that those kinds of results transfer into brain cancer as well. And so we're very excited and hopeful for that.
That is fantastic. I love hearing that. That's super good positive news. And the golden years are the golden age of discovering cancer cures. That's huge.
It's
Huge.
very huge. And I
Oh my
think
goodness.
it's in our lifetime that we're seeing these
Yeah.
cures for different kinds of cancers. So
Oh,
we're
that's
excited about
great.
that.
Good job. I love it. Good job. Excellent, excellent. Well, I want to urge our viewers at Global Positive News Network to go to the broachfoundation.org and take a look around. You can donate, you can volunteer, you can get more education about brain cancer and some of the cures that are happening right now. So, Deanna, thank you so much for being here and for
Thank
letting
you,
us know
Christy.
more about the Broach Foundation. And I wish you the best of luck in the future. And I think you're going to get a lot of good stuff going on. So thank you so much.
Appreciate it. Thank you.
All right. Take care.